3, 2, 1. We are live.
Hi everyone, happy Friday. Welcome back to our second episode of Filter Free Friday or Unfiltered Friday. Today I have Ashley with us.
Hello.
She is our MA for pre and post-op care. And she's my personal hugging partner. So welcome.
Thank you very much. Hi everyone.
Yes.
I hope you're all doing great and I hope you enjoy our night.
So today we're
So
gonna
you know
be
what? I never pressed going
I'm
live.
gonna-
So let's start again.
Okay,
So
good.
now we are live.
right now.
Yes.
Now we're live. Hey everyone, welcome to our second Filter Free Friday or Unfiltered Free Friday. I'm here today with Ashley. She is our MA for pre and post care at Pure. So everybody welcome her.
Hi guys.
Hi,
A lot of you probably know me as Shley. That's my nickname here in the office.
So today we're actually going to be talking about post care for surgeries. For non-invasive procedures such as a belly. We had a lot of questions on how do I do X, Y, and Z after a BBL or a tummy tuck. So we're here to answer those as real as possible. So the first question that we got today was how many liters of fat can be removed during lipo 360 and breast?
So actually with on any breast procedure, if you are adding on liposuction, you are only we're only allowed to retract up to 1 liter of fat. So they wouldn't be able to do a complete lipo 360. It would be considered a lipo 180, and you choose which is your main area of concern, and that's where they would retract the fat from.
And is that only here at Pure or
No, that's here in the state of Florida.
State of Florida?
Yeah.
Okay, well that's good to know because remember, as everyone should know, is safety is our number one priority here at Pure. So we're always gonna go by what is right and safe. Let's do a fun one. How do I use the toilet after a BBL?
So after a BBL, you can either sit on the toilet reverse,
Reverse
or
cowgirl.
you can actually get some towels and just roll them up, and then you place them underneath your thighs. So when you're on the toilet, you're not putting direct pressure to your buttocks or your hips.
And that's because we want no pressure on it.
No pressure at all on the
Okay.
buttocks or hips.
And
for
how
the first 6
long?
weeks.
Okay, 6 weeks. Yeah. So for the first 6 weeks. Oh, okay.
Yeah, but how's that the reverse? I don't get it.
So
Reverse?
so when
Yes, I want to see
yeah,
it. How's
so
that
on
reverse
the toilet.
This is our
This
toilet.
is the toilet seat. So you're gonna sit like this.
Oof.
Woo!
Okay.
Like this.
Uh-huh.
And then if you don't want to sit like that because you find it uncomfortable, like I mentioned, you can just get the towels, you place them right here. So when you're on the toilet, you're not putting direct pressure here.
Oh,
Okay. Well, that was interesting. Let's talk now that we did the toilet talk.
Let's see. So I have a question for you.
Ooh.
Okay, so how's the recovery process after a belly?
Oh, a belly, my fan favorite right now. So post a belly, remember we're cutting those fat bands, right? So we want to make sure that we have compression because once we release that fat band, we want it to go back, the skin to go back and kind of secure itself. So we really want you to either wear like Spanx or a faja that actually has the support on the buttocks, not necessarily your BBL faja because those don't have any pressure on the hips or buttocks. We want you to do that for about 2 weeks.
Okay.
Basically, other than that, you're gonna have a little bit of bruising, but all's normal after.
Okay. And it's okay to sit.
Yes,
after
you
the
can
belly?
sit after a belly 100%.
Okay.
Yeah.
So there's no downtime.
No downtime, no reverse bathroom, none of that.
no video pillow?
No BBL pillow, no.
Okay, but I think you forgot saying who's one of the number one practices right now doing a belly here in Florida.
Yes, so we are the number one practice for a belly right now.
Hey!
Yes. Yes, Yanni, our nurse practitioner, and Natalie are killing it. These girls are booking up very, very quickly. I do have some last spots till the new year, so if you're thinking about it, hurry up, please. I can only do a limited amount every day. Let's see. Oh, this one's fun. When to start massages and what surgeries need massages? Schley.
So you should start massages the day after surgery, whether it's a lipo procedure, liposuction, or tummy tuck. So when it comes down to tummy tucks, you want to make sure that within the first 2 weeks, your massages are only done to your flanks and to your back. After the 2-week mark, then that's when they can move forward to the front abdomen area. With the lipo 360s or lipo to the abdomen or specific different areas, you want to make sure that you do start the day after, and there's really no restriction. Just make sure that they're massaging the areas that were lipoed to help that lymphatic fluid drain out.
Cool. So no massages for like a breast aug or
The only
BBL.
time that massages are recommended for a breast augmentation is when the doctor recommends it. But aside from that, we don't recommend.
Okay, cool. That's good to know. Let's see. Oh, now that we spoke about breasts, can fat be transferred to the breast at the same time as a lift?
Absolutely not. The only time they would do that would be if the doctor, well, they wouldn't do it with a lift, they would do it with an augmentation if the doctor feels like you would be a candidate. But for that, you would have to get a consultation done and see what the doctor's recommendation would be based off of your goals.
Okay. Yeah.
I have a few here.
Okay.
So the first one, is there any downtime for the Botox?
For Botox.
Yes.
So Botox is kind of like coming during your break or your lunch. So we will apply the Botox. And the only restrictions we have is we don't want you to be applying pressure to the forehead for 4 to 6 hours. And no like yoga inversions. So try to keep it light. Don't put your head down. If you need to pick something up because it fell, that's fine. But we don't want you taking a nap or doing this or rubbing the area for 4 to 6 hours. So that's the only real downtime that you would have with Botox. And also makeup. Do not put makeup on before 6 hours because you do have little holes and we don't want them to get infected.
Okay, ladies, we got a question. I think this is for Dr. Earl.
Oh boy.
And I think we can answer this.
Okay.
But I'm gonna read it. And she asked is there less bruising with laser lipo than traditional lipo? I don't know, Schley, you're
So from what I've seen, I have noticed that with the laser lipo, there is a lot less inflammation and less bruising as well. But it would be different case by case, depending on how your body responds to the liposuction, to the trauma, and so on.
Oh.
okay. Schley?
Yes.
Would
She's saying great.
yes, I know this is for him. Oh, this thing's going crazy. Okay, ladies.
Yes.
Now, focus.
Okay. Focus.
Would lipo and tummy tuck be a no prior to pregnancy?
A tummy tuck be a no prior to pregnancy? Well,
I don't think so.
yeah, I mean, I feel like with a tummy tuck, it's mainly recommended like if you're already done having kids or if you don't plan on having kids. But you can always, if you're not sure if you're done, you can always consider getting a tummy tuck done, and later on in the future, depending on how your skin does retract after, if your skin requires another tummy tuck, you can always go for another round. But typically we do recommend that once you're done having kids.
Okay.
Okay. There are more there?
Yeah.
Yeah.
Yeah. What happened to Dr. Rigger's page?
Oh,
Yeah.
I think that's for me.
Yeah, that's for you.
For the community manager.
You're the community manager.
Nothing. We have some technical issues.
Yes.
And now Dr. Wigriff is back on Instagram at Dr. Garrett Wigriff.
So it's his
Ooh.
full name.
His full name.
Perfect. Okay.
Yeah, no dots, nothing at Dr. Garrett Wigriff. So,
Awesome.
yeah. Yeah. It's me. Yeah.
No.
I look nice?
Yeah,
Yes.
you look great. You look amazing.
I have a question for you.
Okay.
So, how soon can you fly after a mommy makeover?
Well, with any procedure here, we have our patients wait 5 days.
Correct.
You are able to leave at 5 days, but
As long as you are cleared from
correct.
surgery.
I was gonna say, as long as you're clear, and you need to listen to your body, right? So somebody that might have had a mommy makeover, they are ready at 5 days, and docs cleared them, they can go. But if you don't feel like you should leave yet, always stay. Listen to your body. Every body is different. So that's how I kind of see it.
Yeah.
Especially with mommy makeovers,
Absolutely.
it's a little bit of a rough ride, and I know from experience. So take it easy. Don't be so hard on yourself, and take your time.
Oh, this is a really nice question. Stephanie, she asked, are the IDO threads contraindicated due to the possible scarring and complication with a facelift in the future?
I wish Dr. Vidal was here right now.
Yes, but I will keep this question for her.
Yes, so PDO threads can leave scar tissue. So when the doctor does go in to do a facelift, could be a little extra work for the doctor. That's why it's always great to be transparent with your surgeon and let them know every single procedure you've already had done to your face, so that when they open their face, they're not scared. They already know kind of more or less what to expect. Yeah.
Jinx.
Look at this message. I'm so excited. I was there on Monday and meet Dr. Earl. Finally, I think this is a future patient or a recent one.
Oh, well, if you're a future patient, I'm so excited to meet you. And if I already met you, hello.
I think you have one more of the...
So, for a person with eczema and rosacea and melasma, what treatment is recommended?
Oh my god, but she has
I know
everything.
exactly who this is.
I know.
So, yes, so with eczema, we need to be very careful with what procedures we're doing with your skin, and we need to be close on monitoring it, because you can have flare-ups with anything. It doesn't even have to be a procedure that we did. It could be something you ate. It can be stress-induced. So we always want to make sure that we're doing pre-skin care, during, post, to kind of make sure the healing is smooth. I love Morpheus, but then again, it's all on how you prep the skin. And Botox and filler is fine with eczema. You might have like a little flare up, but you'll be okay.
Okay, yesterday at our meeting you talked about something important, and it's our skincare line.
Yes.
Please
Yes.
tell them about these
Yes.
products.
So I think we might have touched on it a little bit last week. So we do have Skin Better Science with our Pure Aesthetics and Pure Surgery. So what I love about the Skin Better line is that a lot of you guys are not in Miami, but maybe you want to try it. We can get it mailed to your house. So I can put you on a regimen, or any of the girls here can help you with your regimen. We can purchase it online for you and get it shipped over to your house, so the airport doesn't take it away.
Okay, we have.
Yeah.
Yeah, I have a question. Somebody asked is that Dr. Earl on a horse in the background, and I will zoom in this. Look at that gentleman with the hat, with the horse.
There he is.
Wow.
Yeah.
Looking so young.
Right.
Yes, that's Dr. Earl. He was a champion doing jumps.
Yeah.
Yeah, horse jumping.
He's the GOAT.
He's the goat. How do you say that in English? Horse riding? Horse riding?
Yeah, equestrian.
Question. Okay.
No, but in Spanish.
No, equitación.
Oh,
In
okay.
Spanish.
I'm like, equestrian.
Yeah. Ladies,
Yeah.
that's all?
Yeah, I think that's it.
Um,
Anybody else ask questions in the comments, or?
No, I didn't.
Oh, I have a question.
Okay.
Schley,
yes. Yes.
after a BBL, how long do you have to wait to get it on?
What? How long after a BBL do you have to wait to what?
To get it on. To have
Oh,
sex.
to get it on.
Yeah.
Ay, caramba.
6 weeks, ladies.
6 weeks.
This
Take it easy.
And this
fellas.
is any procedure. no butt smacking.
Yeah.
You want to avoid any flat spots, any indentations, and so on.
Yeah. So
And
guys,
take that very seriously.
yeah, relax.
Hold your horses.
Literally.
Okay, another one. How long do I stay in the clinic after my mommy makeover?
So standard, any surgery can be anywhere between 2 to 3 hours, and the recovery time is 1 hour. So you can calculate anywhere between 4 to 5 hours, as long as everything is well. Once you are out of surgery, they do contact your caretaker and they do notify them once you're out of surgery, and they give them an hour to pick you up.
Oh, nice.
Okay.
All right. Well, I think Shley, you survived your first Filter Free Friday.
I did.
Cheers. Congrats.
Thank you very much. Sipping my tea.
Cheers.
Cheers.
And I hope everybody has a great weekend.
Yay! Well, thank you,
Toodles.
ladies.
Bye, guys.